Hi, my name is Kaneez. I'm a mom influencer and the job comes with lot of hectic routine and a lifestyle that is difficult to maintain. So yes, one flip side was that I was facing a lot of hair issues. So I've come here to Recon to Dr. Pragati and she has suggested me PRP for my hair loss and to improve the texture of my hair. So I'm going to ask her what exactly PRP is and how is it going to benefit me. Let's hear from her. Hi Dr. Pragati.
Hi Kaneez.
So tell us what PRP is. It's such a big word. Please simplify and let us know what exactly it is.
Sure. So PRP basically stands for platelet-rich plasma. Now PRP therapy has been around for ages. It's been around for decades. It's very recently that we've started using PRP in aesthetics. The most common use of course being for hair loss, but then we also use it for wound healing and facial rejuvenation in general.
Oh, that's nice. So doc, why platelets and how does it works in PRP?
So platelets are a specialized type of blood cell. Our blood is basically made up of three cells: the red blood cells, the white blood cells and platelets. And all these cells float around in a liquid called plasma. Now platelets in particular are very rich in growth factors and in bioactive molecules. So when the concentrated platelets are injected into the scalp, what it does is that the growth factors and bioactive molecules present in the platelets, they promote hair growth. So overall PRP, of course, it prevents hair loss. It also promotes new hair growth and increases the thickness and strength of your hair.
Who is an ideal candidate for PRP?
So PRP can be done by both men and women who are suffering from progressive hair loss. It is also sometimes given as an additional stimulant therapy to people who are undergoing hair transplant.
So doc, how is PRP done? Explain us the process in a little brief.
Sure. So the patient's blood is drawn just like getting a blood test, and then it is placed in a special centrifuge machine. The centrifuge separates the RBCs and the platelets and the plasma. We discard the red blood cells and the remaining platelet concentrate is used for treatment. It is this platelet concentrate that is directly injected into the scalp.
Doc, is the PRP therapy painful?
So Kaneez, if injections are used to deliver PRP, moderate discomfort and pain is expected during these injections. We noticed in our practice that sometimes this leads to non-compliance amongst our patients. This led us to introduce a revolutionary technology for PRP treatments at Recon, which is totally painless. That is the microchip transdermal and electroporation technology, which we use for all our PRP therapies. With the help of this technology, we can penetrate the protective barrier of the scalp to establish microchannels. Through these channels, PRP can be introduced into the deeper layers where the hair follicles lie. So Kaneez, what we've noticed is that now our patients are happier, they don't complain of pain and are more compliant to their therapy.
That's amazing. So doc, how much time does the PRP procedure takes?
So the process from collecting the blood to centrifuging it and then actually delivering the PRP to the scalp, it takes around 45 minutes.
So doc, how long does it take for the results to show up, and once you have seen, how long does it last for?
So since Kaneez, this is a biological process that the PRP is mimicking, the results are not immediate. You will have to wait 3 to 4 weeks for the results to start showing. And once they appear, they last from up to 6 to 12 months. Now, of course, the results do vary from person to person, and also how long the results will last, that also varies from person to person. Again, depending on factors like the cause of your hair loss, the duration of your hair loss, age, medication, etc. So initially, we recommend around 5 sessions, 1 month apart. And then we tell you to take a maintenance therapy, say once or twice in a year.
So doc, are there any patients who don't respond to PRP injections?
Yes, Kaneez. Unfortunately, there are some people who will not respond to PRP therapy for hair loss. Like people who may have had a trauma or a chemical injury on their scalp. Also, PRP does not have any role in baldness, where the hair follicle is dead or absent. How I explain this to patients is to think of the hair follicle like the root of a plant and the PRP as a fertilizer. Now the fertilizer will only act if the plant root is present, even if it's in a weak or a feeble state. Similarly, PRP will also only act if the hair follicle is present, even if it is in a dormant state. So PRP has no role to play in baldness, where the hair follicles are dead and absent. In such cases, a hair transplant is recommended.
So doc, one of the very important question, are there any side effects of PRP?
So Kaneez, PRP is quite safe because it's your own blood that we are injecting into your scalp. But after PRP injections, some patients do complain of pain, bruising or swelling. Maybe some amount of redness also. However, in Recon, since we've started using the electroporation technology, we've had no such cases present to us.
Oh, that sounds interesting.
Yes.
So before doing the PRP, do I need a consultation with the doctor?
Yes, it's very important that you consult a doctor. It's not a treatment that you can just, go into a clinic and order, because we recommend PRP therapy only after taking a detailed history, trying to find out what the cause of your hair loss is and whether or not PRP is appropriate for you. Sometimes we may have to order certain blood tests to rule out any autoimmune or hormonal disorder which has been causing the hair loss. And also it's very important that the doctor checks your hair and your scalp so that they can better recommend other supplementary treatments for hair loss.
Thank you, Dr. Pragati. That was quite insightful.
My pleasure, Kaneez.
So guys, hope all your queries regarding PRP has been answered, and if you would like to book your pain-free PRP session with Recon, all the details are given below. Do contact and book your services now.